So I'm Mike Lovett. I'm the Program Director for Genomic Medicine and the MSc degree at Imperial College London. And what I'm going to do first is go through a set of slides, which hopefully Laura will share.
Share these now.
Thank you very much. Which will give you some information on the degree program in genomic medicine. Then we'll go through some of the specific questions you've already forwarded to us. And then we'll take a quick question and answer session, which is just free form and open. And you can ask the questions yourselves, or you can ask them in the chat session, which is one of the buttons at the bottom of your Zoom screen. So next slide, please, Laura. So these, if you join the Genomic Medicine program, are the three people who administer the program: myself, Dr. Laura Collopy, who is the Senior Teaching Fellow, and then Eleanor Walsh, who is the Education Administrator. All of us are present on this call today, so we can answer your questions. Next slide, please. So our MSc is a little unusual. It shares several things with other master's programs at Imperial, including the fact that you will have a lot of interactions with world-renowned researchers, scientists, and physicians. You have teaching from experts and researchers across Imperial College, and in the case of our course, many people from outside Imperial. It has a blended teaching format, and what that means is there's a combination of face-to-face teaching and online formats, which we'll come to in a few moments. There are full-time and part-time options, and we will again come back to this in a moment when we talk about the various degrees we offer. We have external partnerships with two very well-regarded education institutions in London: Brunel University, which teaches our economic roles in genomic medicine, and the Institute of Cancer Research in London, which is located right next door to us and is a leading institution in cancer research internationally, and they teach our cancer module. We also have a very diverse student body who come from many different professional research and medical backgrounds. So part of our program, about a quarter of it, involves medical practitioners. And by that, I mean physicians, nurses, midwives, pharmacists, lots of different people who benefit from an understanding of genomic medicine and how it can be applied within the British National Health Service. Occasionally, we have physicians and medical experts from elsewhere in the world, but it's predominantly from within the UK and predominantly within England. And that leads to a very diverse academic and research environment. We'll come to the constituents of our student body in a few minutes, but it's one of the strengths, I think, that you learn so much from your peers as you go through this course. Next slide, please. So these are, on the left, are the three types of degrees that you can do within our program. The first is a 4-module postgraduate certificate. And a lot of people coming in with NHS essentially funding do that as the first step. And then you can progress on to the 8-module postgraduate diploma. So you can do the PG Cert, 4 modules, PG Diploma, an additional 4 modules. And the majority of students within our program are enrolled and doing the full MSc qualification, which is 8 taught modules plus a 14-week-long research project. And again, we're going to deal with the research project in a few minutes. Okay, so entry requirements. you can find all of this on our website, where the entire learning manual for the course is. Our minimum requirement is a 2-1 degree in a relevant medical, biomedical, or healthcare subject. And you can apply for this in your final year of an undergraduate degree. You don't have to have the degree already. We can give you essentially offers based upon the requirement that you get that 2-1. And we've accepted a wide variety of international qualifications, and Imperial is very, very experienced in measuring attainment in every degree in the world, I think. Even if you don't quite meet those requirements, we do have considerable latitude in assigning you a place. And that really is dependent on whether we are convinced that you really are committed towards genomic medicine and show considerable knowledge and aptitude for the program. And just to re-emphasize that, I think that your motivations and your qualifications for applying for genomic medicine are critical and central to the entire application. It's not just some sort of generic, please let me into your program. We want to know that you know what you're doing, or at least you know some of the basics, and that you're motivated and committed to it. Next slide, please. So the process is pretty straightforward. It goes straight through the normal Imperial College admissions system. And the way it works is this: you're initially evaluated by that team in the central offices of the university, and they will decide whether you can move on to the full application. Then you come to our genomic medicine team within the NHLI, the National Heart and Lung Institute, and they go through a review process. But within those 2 steps, the admissions team and then the genomic medicine team, I would say that maybe 10 to 20% of applications do not pass forward. So the vast majority do go towards the next stage, where you will be invited to interview. And then you have a 20-minute or so interview, usually with Laura and myself. And after that, there will be a decision made about whether to offer you a place within the course. That filter varies. It does vary year by year, and it varies depending on essentially the quality and quantity of applicants. I would say more than 50% pass the interview process. Next slide, please. Now, this rather busy slide, which you can't really accommodate in a couple of minutes, is the timeline for a typical MSc. So and you can see at the bottom, 4 modules for a certificate, another 4 modules for a diploma, and then the whole year is an MSc. Now, if you're doing this part-time, you could stretch it over 2 years or even a bit more than that. But let's just take the sort of standard 1-year MSc. How would it work out? Well, you come in with the first 3 modules. Actually, I'm not sure that is correct there. I think CRID is the 3rd module. But anyway, you get the idea of this. There are 2 times in the year where you're able to do elective, essentially optional modules. So the total year is comprised of 8 modules, and then you choose out of within that 8 are 2 optional ones. So the choices are ethics or genomics in the patient, and then a group of 4 different modules which occurs in March, where you choose one of those as well. So there's therapeutics, pharmacogenomics, professional and research skills, and the economic evaluation of genomic therapeutics, which is the one run by Brunel. So these slides are going to be available to you so that you can look at this in sort of granular detail later on. But each module in general consists of, well, all of them are 1 month long, with the exception of the research project at the end. And the way that works is there's 3 weeks of self-directed study, and there's 1 week of face-to-face, what we call synchronous teaching. That's usually in week 2, so you have to be there. You have to be there face-to-face, usually in a very large lecture theatre. And then the 3 weeks of self-directed learning are usually the first week online, the second week face-to-face, the third week online again. And the fourth week is mostly involved with preparing the assessment for that module. And then you submit that online at the end of that 1 month module, and you're done and dusted, and you move on to the next module. So the great thing is there's no sort of summertime final exam in which you have to swat it all up and do all those exams or sit in an exam room. No, every assessment is on a monthly basis. We'll come to the research projects in a few minutes. Next slide, please. All right, so in the past, these have been some of the we've encountered in these open sessions. We do have a video on our website with some of these FAQs. So take a look at that. When you get these slides, you'll see that that's clickable. So for the elective modules, you may only take one of these per elective group. What that means is you choose either ethics or genomics in the patient in January, and then you choose one of the 4 in March. They are very interesting, and frequently people say, oh, I would love to do pharmacogenomics and therapeutics. Unfortunately, that's not possible. They run at the same time, and you have to make choices. And we ask you to specify what they are by the end of October or November, because we have to figure out the space for all of these modules as they run concurrently. The part-time students and the people who have registered for a cert or a diploma don't have any different content. It's just that they take less modules at a particular time. So they're taking the same modules as the full-time MSc students, but you may be taking them in a different order. If you do come in through the NHS, which is actually funded through a thing called HEE, and I have a slide for that at the end. If you did come in through that funding, then you would be doing your MSc over 2 years at least, and you would choose which of the first of the modules you wanted to do for your cert. And then if you did okay in those, we would say, would you like to do the diploma? And then you can move on after that to the MSc. So it's a stepwise progression, but it usually occurs over 2 years.
I should add that everybody starts with fundamentals, regardless of whether you're PG Cert, DIP or MSc. Everybody comes in October, does fundamentals. And then if you're only doing a PG Cert, you do that on the same 4-week timeline as everybody else. But you might then go away for a couple of months before you come back and do your next module if you're a part-time student. But everyone does start with fundamentals and has to pass fundamentals. And then the remaining modules are your choice if you're only doing 4 for a PG Cert, or if you're building them up, the order you do them in is your choice. But yeah, sorry, everyone starts with fundamentals. Just wanted to mention that you'll be expected to come in the October for that course.
You don't need to be sorry. That's a very good point, one I should have made. The other thing about it is that, the way the structure of this course is such that, and I don't say this, facetiously, but this is not MSc light. This is full force MSc. You've got 3 weeks in the month in which you're doing this learning yourself, and 1 week in which you're getting quite intensive face-to-face interactions. So it is conducive to people who have full-time jobs, as long as they can take off that week to have face-to-face interactions. We'll come back later on to discuss what can be in those face-to-face weeks. It's not sort of typical didactic lectures. Some of it is, but a lot of it is what needs discussion, what needs a little bit more interaction to really get the point. So what is self-directed learning? It's a whole bunch of things. It's not just a bunch of videos. It's probably about 30 hours of material per week in the allocated week. And that may be online lectures, it may be readings, it may be interactive courses, it could be all sorts of things, and it frequently is all sorts of things. If you have a module, and most of them are this way, in which you have week 1 is what we'd call scaffolding, that's stuff to get you up to speed for that subject, then you need to do that week 1 material before you get into the face-to-face for week 2. And in some cases, that means you got to read some papers or watch some lectures, and then you come into a discussion session or a journal club or something like that in week 2, where you need to be up to speed. But that will all be clearly laid out in the introductions and specifications of the module. Next slide, please. Okay, projects. We get a lot of questions about how you choose and how you get allocated these, because different MSCs have different philosophies about how this should work. We are not paternalistic about projects. We like to give you, pardon me, the feeling that the world is your oyster. Now, Imperial has an enormous number of leading edge investigators in genomics, but we don't just constrain ourselves to that. We've had many, many people who have looked at other institutions, especially within London, such as King's, UCL, the Crick, the Turing, Oxbridge, so Oxford and Cambridge. And as you see at the bottom of this slide, we have had many people who have done projects in good institutions in foreign countries. If you do a project, if you choose to do a project in a different institution, then we will appoint an Imperial co-supervisor who will make sure that you keep up to the standards of the science and of the dissertation as well. But my point here is that really we just want you to do good cutting edge research. Now, complementing that is the fact that every year we go out and ask our many, many investigators if they have MSc projects, and they will come back to us with a series of titles and research projects, and we give that out to all of our students, and then it's up to them to cement the project. So they've got options. You can maybe even do a project with somebody who lectures you and inspires you, but that gives you the basis for doing a whole range of different genomic projects, which may be wet lab, they may be dry lab, and some of them may be literature based, but we have some requirements for that as well. It's not just willy-nilly, and it's not just that you think it up off the top of your head and suddenly have this inspired epiphany. You have to complete a detailed research project proposal. It will be reviewed by faculty and approved, and then you're off and running. Full-time students complete the project over 14 weeks, and that starts in June, ends in September. Part-time students, which would be all of the sort of HEE/NHS funded people who are doing their entire MSc over 2 years or so, have up to a maximum of 12 months to do this project on a part-time basis. So the parameters are carefully measured to make sure that everybody's on a level playing field in terms of achievement during this time. So we really want you to get something substantial done, but we're not asking you to do an entire PhD, for example, in a 14-week period. All right, next slide, please. Oh, I should have pointed out that the project is comprised of 80% dissertation and 20% oral evaluation. So you're spending 3 months of your master's doing that, and you do that dissertation. It is evaluated by 2 qualified faculty, but separately you do an oral presentation of about 15 minutes or so, and that is 20% of your mark for your research project. Thanks, Laura. So, what do people do with this degree? Well, I can't remember how many years we've had this. I was the first program director of this MSc, and I think it's 5 or 6 years ago. But we started out with about 8 students. We have now about 60 or 70 per year, and then we have a turnover of part-time students as well. So our footprint per year is getting close to 100 students, and they really cover the waterfront when it comes to genomic medicine. Many people come in with an undergraduate degree and they want to stay in science or research. So a large number of people go on to do PhDs. And we can give you many examples of those. And we were talking today about posting more videos about these people on our website. The research project can very frequently be an entry point into that path. So we have many students who do an MSc and then are offered a PhD within that same research group. We have been remarkably successful in getting our students into the Clinical Scientist Training Program, which is an NHS-funded stream where you are paid to be trained as a scientific expert within the NHS. It's extremely competitive, but the great thing is that our students come back and give our current students, our former students come back and give our current students some insights into how to get through that program. We have strong relationships with big pharma and with biotech, and many people come in from pharma to be trained in genomic medicine and go back to essentially bring those insights into their pharmaceutical environment, and I've done very well in there. Within the physician and healthcare area, people go back into their clinical setting and really bring genomic insights into the clinical setting, especially within the UK. Because, as I'm sure if you're on this call, you know that genomic medicine is a standard of care within the NHS, and that is increasingly requiring people who can interpret genomic data and advise patients about the implications of their tests and procedures. We also have had many entrepreneurs and finance people through our program who, in some cases, have wanted to get into the real nitty-gritty of what genomics can do, as a pharmacy or a pharmaceutical or biotech possibility, and they can continue to apply to our program, and we very much welcome them. Next slide, please. This is really just to reinforce the fact that as an MSc student or in any of our programs at Imperial, you have a wide network of college support, focused upon welfare and academic support. So you see many of those listed here. We are very conscious that people can get stressed. We're very conscious of the fact that they need advice, support, contact, and connections. So we try to provide a lot of that. And if you came onto our course, then you would be given a listing and a lot of connection to these professionals. Next slide, please. We get a lot of questions about fees and about financial support. We do not have a sort of, big war chest of tuition money or scholarship funds that we can give to you. We do have money from Health Education England, but to be part of that, you have to be a currently employed NHS employee, and you must have the permission of your line manager to do this course. And we have trained dozens and dozens and dozens over the years within this scheme, which is very far-sighted, and we work very closely with HEE to make sure that people achieve their goals within this. But for the average person coming in, I'm afraid you could try all of these various sites, but we do not have insights into special scholarship funding for MSc programs. And it's not our expertise, but it is within these, the student scholarship information programs at Imperial, which you would have. Next slide, please. This is just to ask you to join our mailing list and to scan our code there, and you'll get a lot more information out of that. And we'll keep in touch with you. Next slide, please. I think that's it. Thank you very much for listening. We'll do a general question and answer in a moment. Let's actually go to the HEE slide, Laura, which is the next. It's okay. Let's address the HEE thing. Next slide, I think. Yeah. Okay. So for any of you who are on the call and you want to avail yourself of this, as I said, you need to be a full-time NHS employee. You need to be able to get your line manager's sign-off of that 1 week per month to do the course. And that is, you have to apply initially into the postgraduate certificate. Now, the reason you have to do that 4-module selection is that HEE decided they wanted to fund 4-module chunks. So essentially, they'd give out the funding for 4 modules, and then you decide whether you want to progress on to the diploma, and then after that, whether you want to progress on to the master's. Historically, the vast majority of people applying to us through HEE funding have eventually done a master's in genomic medicine. And we're not going to get into it here, but it covers every possible area of modern medicine. As I said, we've had midwives and nurses and physicians of every sort from every speciality you could think of. So sometimes in genetics, you find that it's very much confined to pediatrics or maybe OBGYN, but not in this case. It's everything. We've had a lot of nephrologists. We've had a lot of people from oncology and psychiatry, everything you could think of. So don't be bashful. Join this, because this is a revolution that's happening out there in the real world of the NHS. Initially, you have to apply to Imperial and get accepted by us. So you still have to go through that application and interview process. Then you'll be told whether we can offer you a place upon our funding allocation. And now is the right time to do this, because this is when we decide on our funding allocation for this coming year. The way we do that is that current students who are on this program, we look at their academic progress. If they're doing well, we give them the option of progressing their degree. If they say they want to progress, we're going to help them progress. And we do that in liaison with HEE, which is Health Education England. Once we've taken care of them, then we take care of our new applicants. And we've taken in lots and lots of people every year. So we have a very strong relationship with HEE. We have a good idea about the workload of health education professionals. And we think that this is the place where expertise and interpretive abilities for genomic medicine is paramount. So please apply. We're very, very happy if you want to come and learn from us. If you get accepted by us, then really it's relatively straightforward to have HEE buy off on your application, and then you're approved for the course. Right, next. Oh, no, that's it. That's it. Okay. All right. So if you can close your one, that's great. We did have some questions submitted prior to the meeting, and I want to go through those quickly and address them, and then this is open for all questions. So the first question I have here is, what is the scope of genomic medicine in Asian countries? That is a pretty broad church. There's a lot of interest. We have had many people from Singapore, Malaysia, China, Indonesia, and India. And I would say there's interest, but the vast amount of funding and the vast amount of application of genomic medicine, true application in a clinical setting, is within the Western world, but it should be everywhere. We have had applications from applicants, as successful applicants who have gone through the program from practically every country in the world. And we are very sympathetic to the need to spread this kind of new diagnostic and therapeutic insight into all of humanity. And that's not grandiose. I think it really can be done if we have people who go back and spread the word about how this can be so revolutionary. The second question is, I want to join the course for enhancing my career, but need scholarship for a study. Well, I think I addressed that. There are scholarships out there, especially things like the Chevening Scholarship, which I think is run through British consulates or embassies. They are great to get, but they are highly competitive. There are many nationally run scholarships, which many of our students have had from other countries, and they are very successful in terms of achieving those. But we do not have any sitting in our back pocket. I wish we did to competitively give out to our students. So, look at my slides about tuition and finance. What are the career opportunities after completing the course? Well, I've alluded to many of them. I think that the very big one is genomic counseling. Many people apply to our course because they want to become not just genetic counselors, but genomic counselors. And I applaud that, because I really think that's where it's the pointy end of delivering genomics. It's really being able to interpret very complicated data in a digestible format. So that's one way, but there's everything else. I mean, this is an expanding field. It's huge. And within the well-funded research communities, and by that I mean the US, Canada, Australia, the UK, Europe, in particular. This is a burgeoning field. So there's lots and lots of research opportunities, but it's not just limited to that. There are many, many companies. You can see that every big pharma company has got a pharmacogenomics division. One person says, I'm a nurse and I'd like to grow professionally in the field of genetics and genomics. Is this program open to health professionals? What opportunities does the panel see in the intersection of nursing and genetics? For several years now, we have actually specifically targeted nurses for this program because we think they are the people to deliver the insights at the right place and the right time. Not to say that physicians don't bring great insights, but they tend to take them back to their big practices and their big divisions and maybe have enormous research impact. But in terms of really interpreting basic DNA sequence information, things like that, being able to tell people what a 23andMe readout is, or these, direct to consumer type of DNA sequencing things is, that's really important. Do you have a fully funded scholarship? Only within the HEE format, I'm afraid. It says, tropical diseases are included in the application of genomics and infectious diseases module. That's set as a question. So it means are tropical diseases. Not per se that I know of, but I would say this, that, there are so many diseases out there, infectious diseases, that are amenable to a genomics approach. Coronavirus was quickly adopted, and my goodness, the insights that genomics brought on that were enormous. If you just want to see how quickly genomic methodologies can be rolled out in epidemic proportions, look at Ebola in West Africa. So the point there is, what you're going to get taught are cutting edge genomic approaches that are applicable to essentially all infectious diseases. When should we hear back about a decision regarding our application? Within a couple of weeks, sometimes quicker. What happens is, once we've been through the review and we know we want to make an offer, we put that through our admissions office. And sometimes it takes a little time because, my goodness, they're handling tons of stuff at this time of the year. But what we do as a genomic medicine program is we will, within a few days, send you out an email telling you that we're very happy that we'd like to offer you a place. So that should happen within a couple of weeks. And then you just have to wait for the formal letter to come from college. Can one make an application while in their final year of undergraduate study? Yes, please do. And the sooner the better. And we will, as I said, make offers conditional upon a particular degree. But there's nothing wrong with that. It's a done deal if you pass all the processes. Somebody says, I have a PhD degree in genetics, but I'm interested in acquiring another MSc in genomic medicine. Am I eligible for the program? Yes. And we do not. And you may have another MSc. We've had people who have previous MScs and PhDs, and we have a lot of people with both, like BBSs and PhDs. So we have lots of supremely degreed students, and you're all welcome if you have a genuine interest in genomic medicine and can do something with it. All right, I'd like to throw it open to random questions.
We do have a few in the Q&A. So what is the face-to-face contact commitment for somebody who wants to do the part-time masters?
The commitment is for an entire week, and it is per month. And that means about 35 hours. So it's real full-time. So, we say it's 9 to 5. Sometimes it can drag on. And it varies module by module, but we really are, and we've continued to try to make this content useful in a face-to-face format, so that you have discussion sessions, so that you meet and interact with a lot of students in the program. And so we don't put you always in the same group of discussants. We'll move you around. We'll try to make sure that you get a really good experience of other people's opinions and experience. But you do have to be there. Now, we understand, especially for physicians, that there may come something that you just can't get out of for an hour or two. But you can't take the entire week and fly it away. You have to have that commitment. And that is part of the commitment that an NHS line manager has to sign off on.
Yeah, so what I was saying before was that everybody starts doing the fundamentals module. You do that module on the same timeline as whether you're full-time, part-time, you do those 4 weeks. And then if you're part-time, you might go away, you might do the next module, or you might go away for a few months and then come back, and you do the modules on the same timeline as a full-time student, but you may then take breaks in between modules and not do them all in a row if you're part-time. So somebody said, hello, as an NHSP worker, would I be able to receive funding for my study?
Yes. So you can contact your line manager. You can actually leave that aside if you're a bit worried about that, and contact HEE, tell them your position and your employment contract, and they will get back to you. And then if you want to pursue it, then you go and talk to your line manager. And yeah, I encourage you. I mean, if you're committed to genomic medicine and gaining insights is going to change and is changing medicine and science, then pursue it. The money is there through the NHS.
So somebody said, in relation to what you mentioned about HEE and line managers approval, what recommendations do you have for specific nursing roles and or units and facilities I can apply for to be able to develop knowledge and skills aligned with the program? So this is coming from an international student or applicant in the Philippines. From what I know, new international nurses start at band 5 roles.
I don't know the specific bands, so I don't sort of memorize those, but we have literally dozens of contacts in every kind of medical speciality. So, and they are very, very interested in continuing to apply in genomic insights. You know, once they've done the course, they go off. I mean, there's many of them write to me and say, you know, in the first few weeks, I was taking the material and taking it into the clinic and saying to my colleagues, look at this, we could be doing this. So I think it really does cover practically every role. In the past, 20 or 30 years ago, you might have found that, you know, it was mostly pediatrics or OBGYN, prenatal diagnosis, things like that. But no, I mean, we have a large number of people working on kidney diseases and the genomics of it. Obviously, because we're based within the National Heart and Lung Institute, we have a vast number of cardiologists and respiratory scientists, but that really translates into every field you could think of, and we can put you in touch with those people if you're part of the course.
Can I be outside London for 3 weeks during the distance learning weeks?
Yes.
We won't know.
we won't know, but we'd recommend. We had one student who's actually going to, you know, work in Korea, and you know, that became a bit of a problem. You know, they made it to the face-to-face week, but you start to see all of that travel starts to erode on their academic performance, and you sort of say, "You doing all right?" Because they don't necessarily tell you. So don't push it too hard. But yeah, you know, we're not going to suddenly in the second week when you're not required to be there say, "We need you here now." So there's none of that. But you need to be there for the face-to-face, and you need to deliver on the assignments.
Yeah, and also during the self-learning weeks, Mike has explained earlier, we have weekly drop-ins. You'll engage with your peers, and there are discussion boards if you have questions. So you're not completely on your own during those weeks. So you don't have to be in London for that. But it's helpful for your learning if you're engaged and available and available to communicate during those weeks. I'm just thinking, if somebody's far away on a completely different time zone, it might be harder for you to have a meeting if you wanted to arrange a meeting with us if you had a question, or if you wanted to come to one of the drop-ins. But the short answer is yes, you can be outside of London.
Yeah, you can. We love to see you. If you want to drop by our offices, say hi, and discuss all sorts of things, we're very happy. And as Laura said, Laura and I have weekly drop-in sessions where we commit time to seeing all students. And those are quite amusing because the students tend to turn up from fear of missing out. They sort of sit there and they hope they're going to get stuff. And occasionally we have long discussions, but most of the time there's a lot of people waiting to see if they're going to be able to ace the assignment.
But we do help with, if you have questions about the assignment, we're there, we help. If you turn up to these things,
we do. Yes,
you have questions, we answer them. So that it's good to be engaged during these e-learning weeks.
Yeah.
But it doesn't really matter where you are for that. So I'm a dietitian and I'm keen to investigate nutrigenomics. Would this be supported as a dissertation project?
Yes. It certainly would, and that would be quite interesting. And we have an awful lot of people interested in nutrigenomics, and especially the microbiome. So we have a lot of investigators who are into investigating not only the conventional sort of bacterial microbiome, but the fungal microbiome, things like that. So yeah, that would be right up our street.
That's the last question in the Q&A.
Anybody else?
I think what we'll do is in the chat, I'll see if I can attach the slides that we shared today. Oh, no, we have another question. I'm currently employed as an NHSP worker outside of London. If I want to apply for funding, should I be employed by an NHS trust in London first? Because at some point they want to work in London and not commute.
Makes no difference whatsoever. You do have to be within England because it's Health Education England who fund it. So that means you walk over the border into God's country, Scotland, and you're not. But yep, it doesn't matter. We have people who have commuted down from Birmingham and Sheffield and all sorts of places. Now, bear in mind that there are other preferred providers like us. There are 7 different academic centres within England that are funded by HEE to provide a similar sort of MSc. We're all slightly different, but so there, Exeter covers the sort of West Country. There are places, funding in Manchester and Birmingham, and then there's several in London. You could apply anywhere you like. You don't have to go to your next door preferred provider. You can come to us.
So in the chat, the main chat, I've added a link to a new Genomic Medicine scholarship, which is up to £3,000, and that's for international or home students that people might be interested in having a look at. That link to that scholarship is there, and a link to the slides today is there if you want to have a look. And it's also got the links to the website, the mailing list, and the Instagram. And I think we've now got more questions, but just to let you know that information is in the chat.
Hi, Laura.
Okay.
Yeah, thanks. I've seen you posted them, but it's gone just to host some panelists. You need to select go to everyone when you send
Fair
them.
point. I will do that once I've read out these questions. I'll just check that over. Thanks, Jen. So somebody said, are there any compulsory wet lab modules?
No. So, I mean, there, I don't know how, we somehow have become a non-wet lab course. We used to have a module called lab skills because we had an awful lot of people who'd never really worked in a research lab. That became so oversubscribed and so intensive that we decided to get rid of it, which I still sort of regret. It was an enormous workload. And I flatter myself that the students loved it, but we just couldn't keep it up. It would have to have been almost like its own MSc. So the only wet lab stuff that you would do would be within your research project. Now, we do have a month of bioinformatics. That's not wet lab, that's by definition dry lab. But that's the only time that you'll be sitting actually, deriving and analyzing data, but it will be at a computer.
And if you do a research project, if you don't want to do a wet lab research project, you don't have to for your MSc. But if you particularly want wet lab experience, the final research project is the opportunity to. But you don't have to if that doesn't interest you. You can do a computational project for that as well.
Yeah.
When does the application close?
The answer facetiously is almost never. We go on interviewing into August, and I see as part of your question, you say you're still waiting for some results. Don't worry about that. Go ahead and apply. We can always take those things, as okay, pending that. We'd much prefer to talk to you and find out whether you have the right motivations and qualifications than you to miss the supposed deadline. But we do, still talk to people in, I think, August. Is that correct, Laura?
Yep. It's more difficult for international students that have to sort visas and coming from overseas. It can be more challenging. So we went to about August last time, and more like the start of August if you're an international student, and the end of August if you're a home student. But there isn't a set deadline. If you want to apply, the sooner the better. But there isn't a set deadline for the closing applications. So could you talk about the cost of living for students in London?
Well, it's been a long time since I've been a student in London. Laura, you probably are closer to it than me.
Yeah, it costs a lot to live in London. When I was a student in London, when I did a master's at UCL, I actually lived at home, so I didn't have to pay rent. So I can't. I mean, I can't comment. You get student discount with your Imperial card, which helps. It costs a lot. You're in Kensington. Coffee costs a lot. I'm not really sure how to answer that question because I don't know how much you could expect to pay on accommodation, and it depends where you want to live. If you want to live in London, London is enormous. There's a big difference between trying to live in Chelsea or rent a flat in Chelsea and renting a flat in Croydon. There's a big difference. I'm not really sure how to answer that question. It's going to be something that is quite specific to each individual's circumstances and where they plan on living and how and with who. It costs a lot to live in London.
Yeah, I mean, there are many, many upsides, but the cost of living for students is not a good thing, and Imperial is constantly struggling with it. Trying to, I mean, we set various, guidelines and all that sort of stuff, but it's a big city doing a lot of high price stuff, and being headquartered in South Kensington doesn't make it any easier.
I
Now,
think Jen's just she's posted a link about student fees and funding and managing your money and living costs. So that might be helpful.
Good.
More helpful than my answer, I think.
Well, your answer was much more helpful than mine would be.
It costs a lot. That's the bottom line. But there are ways to kind of consider this and manage, and it's just going to depend on individual circumstances. So it's probably best to go and have a look at that link, and see what applies to you.
Yeah.
Does Imperial offer postgraduate accommodation? I'm afraid I don't know that. I don't know.
It does, but it is extraordinarily difficult to get into it. So we do have halls of residence, and I mean, that's nice. So that's sort of off Prince's Gate and all that sort of stuff. It's extraordinarily difficult to get into it. There is postgraduate accommodation, but you'd have to look into it. And I think that Jen is probably posting more.
Yeah, there's another link ready for you there to look at the accommodation. Thank you. Okay, I think that's the last question.
Well, we welcome your applications. Please, understand that we are, really, really wanting to educate the genomic experts of the future and the people who are interested in applying these new approaches. And if you've even scratched the surface of this, you'll know that this is something that has again and again changed people's lives. This is not just virtual. When you see somebody who, is a few months out with a melanoma that is out to here on them, and then gets that sequenced, mutationally analyzed, and as a result of that has targeted specific therapies, and several months later they have no tumor. That's revelatory. It could be for so many diseases throughout the world. And if you even took pharmacogenomics, the simple things that could be done right now, right this minute, if people had the gumption and the vision, we could be checking people for drug reactions, for drug efficacy, for drug susceptibilities, for things like codeine, for painkillers, all things like that. We could be doing that today and change the treatment of so many people to their benefit. So get on board, apply to us, and we will get back to you.